Okay, first thing I'll do is check my medical order, just make sure I have the right patient, I'm doing the right procedure, and I gather the right equipment that I need. And once I have all that, I go into the patient's room. Hi, I'm Funto. I'm a student nurse at Wichita State University, and today I'll just be helping insert that Foley catheter to help with your urinary retention. It's basically just a tube. We insert that tube in your urinal opening in your vaginal area, and then we inflate this little balloon just to keep it in place, and it just helps your urine drain into the bag. Okay, so our hand hygiene. And first thing I'll have you do is, can you verify your name and date of birth for me? Okay, good. Once I've done that, I'll make sure the bed is at a good working height for me, which right now this is. Then we're just going to cleanse your vaginal area. So first thing I'll do is hand hygiene again, and then, before doing that, I would provide privacy. Then I would hand hygiene, and then I would don on my clean gloves, and then we'll just raise this up here. Okay, good. And then I'll grab a clean bowl that has clean water and soap with some washcloths, and I can help you do it, or I can assist you with it if you need help. So we're just going to wipe the whole vaginal area, and we'll wipe your inner thighs. And yeah, once that's done, we'll dispose of the basin. I discard my clean gloves. Well, now they're not clean anymore, but I discard my gloves, and then I'll hand hygiene again. Then we'll go to the sterile portion of this. So I'll just take this out and dispose in the trash, and then I will, just in case, just hand hygiene again, doesn't hurt. And then I will open this using sterile techniques. So the part that's farthest away from me, then these flaps on the sides, and then the part that's closest to me. And using that 1 inch margin, I'll just adjust this the way I want it to be. Okay, the next thing I'll do is I will grab my sterile gloves, which this one is already open because we're out of this size gloves. But then I'll also make sure that my sterile table, before starting, I'll make sure my sterile table is above my waist. Okay, so we'll open this up, and then I'll open this packaging, making sure not to touch the inside because that would make it non-sterile. And I'll make sure to use those flaps and make sure everything is as flat as it possibly can. And make sure to also use this 1 inch margin to straighten that out. Okay. Okay. So we'll first wear the dominant hand first, which for me is my right hand. Making sure not to roll. Okay, that's good. Then I will make sure not to touch this non-sterile part of the glove. So I'll insert my fingers right underneath. Okay. And once I have a good grip, I will, okay, I'll bring this up. Then I will wear that good, and then I can adjust if I need to. Okay, and then I will toss this in the trash. Then I'll inspect my kit, make sure it has everything that I need. And okay, and this does. So yeah, I'll just move this closer to the patient. Yeah, I want it. Okay, good. Okay, then I'll take this and just drape this underneath the patient. Once again, making sure not to touch the patient or the bed or anything that will make me unsterile. And then I'll take this also just drape that right there over the patient. Then I will dip this part right there. I'll dip this here into the lubricant jelly, and then I will grab this part here and connect this to the port right here. Okay, once all that's done, I'll take my swabs here. I'll just toss that in the trash if I want to. But I'll take my swabs here and I'll just wipe that vaginal opening. So with my non-dominant hand, I'll hold this open. I'll wipe this part of the inner lip that's closest to me. I'll discard that. I'll take the other one, wipe the part that's farther away from me, and discard that. And then I'll wipe the the opening right there, right down the middle, and toss that. Then I will grab all of this, making sure not to contaminate that, and then grab all this together at once and just place it right there on the bed. Okay, then we'll put this right there down into that opening till we see urine, and once we see urine return, would advance it 1 to 2 more inches. Then we'll inflate this. We'll inflate the balloon, and then I'll hold this in place with that non-dominant hand and move that syringe, toss that in the trash too. Then once that's done, I'll give this a tug just to make sure it's in place, which this is. And then I will take the bag but right now all this is on sterile only, but just put that. I will attach this part to the inner thigh and clip this to the sheet, and then I'll take the bag and hang it right there on the bed or bed railing just to secure it, make sure it's in place. And then once all that's done, I would take all this off, but right now I wouldn't, just in case somebody else needs to use it. I would dispose of my gloves, and then I would cover the patient back up. Okay, how was that for you? You think you tolerated that well? Okay, good. Then I'll just hand hygiene again. Okay, good. So if you do feel any pain or discomfort, or if there's any blood in your urine or swelling or anything like that, just hit this light. So this is your call light. This is how you get in touch with your nurse. So just hit that light and we'll come right in. So is there anything else that you need from me? No? Okay, good. So I'll lower this bed to the lowest position, okay? And then I'll just put on some clean gloves and I'll clean this whole area, put all this stuff away in the trash, and then I will exit the room. Okay, then once I'm out of the room, I will document, and I will make sure I put the date and time of this procedure. I'll make sure I put the reason for insertion, which in this case was urinary retention, and the size of the catheter that we used, which was a 14 French gauge catheter for females. And then I would record the amount of urine that came out, which let's say it was about 350 ml, cc's, and the color of the urine, which was clear yellow. Then I would record the amount of solution that went into that balloon, and it was about 10 cc's. And then I would record the the amount of solution that went into, which was 10 cc's, and how the patient tolerated it, which they did very well. They took it very well. They didn't have any pain or discomfort or anything like that. And that's it. That's how you insert the Foley cath. Thank you.